Hi, I'm Dr. Swathi Sunil Rao, consultant pediatrician and pediatric intensivist, currently working at KMC Hospital, Mangalore. Asthma is a chronic or a long term condition which affects the airways or the windpipes of the child. So, it is a unusual allergic reaction. That is, when the child is exposed to certain allergens, the child unusually reacts to this. So, that main reaction is where your airways they become swollen and narrow, making it difficult for the air to enter and exit your airways. So, it can happen suddenly, but it goes on to for long term problems. So every child who has cough or wheezing, we don't label it as asthma. We have our set criteria. That is when it becomes very recurrent and it affects the day-to-day lifestyle like sleeping and schooling, then we label it as asthma and start treatment for asthma. Wheezing can happen transiently or temporarily after an infection in a child where it doesn't really require long-term treatment. Is asthma curable? We cannot call it as a cure, but it is definitely treatable because it is something inherent allergic reaction. So we have very good treatment, and if the children are compliant to this treatment, they usually grow out of asthma. After a few years, the child can be completely out of the problems. What are the signs and symptoms of asthma? So especially after allergic exposure to the allergens and after a mild viral infections, the children can have symptoms like cough, especially which happens late in the night or early morning after the child goes to sleep, or after a bout of exercise, child is having chest tightness, feeling difficulty in breathing. These are the signs of asthma. So, cough is a very common symptom, but when the cough becomes very much recurrent and chronic, we think of asthma. So, how do we really prevent asthma? That is, prevention is only by making sure that your child does not expose to the triggers. The common triggers are dust and pollen, and maybe cigarette or BD smoking, the fumes which come out of the smoke, and the regular environmental pollution. Some children on exposure to cold air or strong perfumes or like your mosquito coils or strong smells can have a trigger of asthma. So prevention is always better than cure. So what do you do or how do you understand that this asthma attack of your child is pretty severe? So if it is a mild difficulty in breathing and chest tightness, you can give the bronchodilator syrup that you have at home and try to manage. But if your child is having very heavy chest tightness, not able to breathe, having nasal flaring or chest retractions, not able to talk in sentences, becomes very drowsy and starts turning blue. These are the signs that this child requires the medical help for treating this attack of asthma. So, few things which you should not do is self-medicate with the cough syrup you have at home. Also, nowadays it's becoming a trend to use nebulizations at home. So what the doctor has prescribed before, the same nebulizer is used at home. This is not recommended because you need to always drive these nebulizers by oxygen. So what happens when the drug goes into your child's airway, what happens is your airway dilates and there will be oxygen requirement. So if oxygen is not available, only the drug is available with the nebulizer machine, then your child can go into hypoxia. So avoid giving nebulizations at home.